Hey guys, it's Joshua Herzog over at Johnston Willis, OrthoVirginia. I just want to put a quick blurb out about low back pain and kind of talk about what I see in my clinic on a daily basis. And so low back pain, pretty ubiquitous throughout our society and in general our population, even right here in Richmond, Virginia or Midlothian. I see a lot of it. And some of my job is kind of to work through as a detective and kind of talk about where I think that pain is coming from. And so really there's a couple different sources, but if you look at this little mini model of the spine, you can see in that low back area, right behind the pelvis or along where the belt kind of sits on people's hips, that's considered in general the low back. And so in that area, you can see there's some joints that are called the facets. In the front, there's some discs that kind of live there in the front. There's some nerves, these little yellow things that stick out. There's some other joints called the sacroiliac joint. And then of course, on top of all of that is some muscle and tissue and ligaments that kind of help control and live and move that area of our spine. And so any element there that kind of gets irritated can kind of really shoot people through the roof and be very debilitating. And so what I want to talk about specifically, because again, any one of those things can kind of go bad, but what I want to talk about is this sacroiliac joint, which is this little area on the back side of the spine. And that area can definitely get inflamed. And just like you can get hip arthritis or knee arthritis or shoulder arthritis, you can get some sacroiliac arthritis, and it hurts right in the pinpoint low back, kind of off to the side. Most people have a little dimple there that you can push on and sense it. There's some special tests you can do to kind of compress the pelvis and see if that hurts it or irritates it. And then oftentimes therapy or sleeping position or massage will kind of cure that, but occasionally we have to move into injections, and then occasionally we have to move into a surgery. But that's sacroiliac disease, sacroiliac dysfunction, sacroiliitis, all of those kind of mean disease or irritation of that SI joint. Pretty common location to have some low back pain, and we got some pretty good treatments for it. So I hope you guys are doing good. Have a great 2023 and 2024 coming up. Good to see you.